scared men before, it's not stable.
Sorry?
No, I'm scared men before, it's not stable.
It's not stable.
And I'm trying to write.
Guys, just do the let's do the thing.
Jonah is still on set. Then. Is Jonah still on set?
Yes, sure. Yes.
Is Jonah? Tifunza Jonah kachini papipi.
This one. Okay.
Where we are standing, the moment the minister comes, we won't be able to get it, and we'll just have to push the mic there.
Guys, uma microphone, um bom facapa. Ndi.
What's that yourself?
Ah, você não tinha sabe.
Tell him we don't have the luxury of that.
Não faz que seja. Você tá com fire, né?
Tell the madam that the minister is outside. A lovely morning. continues to be a source of concern rather. So we have over 3 million and 500,000 cases of COVID-19 virus, and recoveries stand at 1.1 million, which is a positive in the number of people that have lost their lives as a result of this global pandemic, which we should all join hands to fight, stands at 252,000, which is a huge number there, and we're only hoping that this situation could be contained, and the Center for Disease Control did come out in the statement to say maybe the earliest that this global pandemic can be dealt with could be in the next 1.5 years. That we are talking about maybe June next year. With what is currently happening at the moment, you see countries on lockdown, people have been calling for Zambia to be locked down, others are calling for the capital cities that have been the epicenter for the lockdown. But experts have come out in the open looking at the economic impact that it will have on the Zambian economy. And that's the more reason why the government has been reluctant and putting a shutdown to restart up. Let's talk about these cases, Darius, and yesterday one of the interesting, quite unfortunate news item that we had was of Ian Tambo, the 24-year-old medical scientist. He lost his life in Lusaka. Lusaka, all the people there was putting those samples.
It has become the biggest story as regards to COVID-19 pandemic here in our country. Many people have been able to wonder how the world is allowed to transport and earn the COVID-19 sample. Many emotions have actually been formed, and we have seen politicians commenting on this particular story. And the government, the Community Association of Zambia, also have been more commenting about this particular unfortunate development, so to say. The minister yesterday told us that investigations are underway, but then we understand that where this particular thousand people scientists rather came from, that Zambia is quite a small area, and obviously I think there are some information that have already been gotten from the ministry, and we'll be able to get to find out in one has been obtained. But earlier on, our colleague Rodan has been covering this particular story, has an interview with family members, and what so far has transpired as regards to health is that government has been able to release 10,000 to help with the funeral arrangements. And information also that they have been able to get from the family members is that obviously maybe we'll be able to see the body being transported using a chopper. I think this is something that we'll be able to bring out as our reporter, Rita Mvula, who has been interacting with family members, get detailed information. And Bobby, I think many people are waiting to hear the outcome of the investigation from the Minister of Health, looking at the magnitude of this particular story and also the reaction that it has been able to attract. This development came at a time when we saw the resident doctors, also wanting to have a meeting with the government, airing their grievances on how the frontline workers, the challenges the frontline workers are facing even as they fight COVID-19. The meeting has not been held yet at the moment, but the minister indicated to us when I actually posed the question on this particular subject, he hinted to say they have been able to interact, and I think this is something also that is of interest, and who I think will be able to update the nation on what will happen in that regard.
Indeed, there was our just Bishop they are watching the South African government together with our own staff in India and in the morning, somewhere around 3 to 4, I was with the South African minister around the Makeni area there, and
the areas where this is happening. I think this is a warning to the residents in such localities where this development is occurring. For me, just like the World Health Organization has been able to preach, I think fighting COVID-19 also begins with oneself. Are we able to wash our hands? So are we able to sanitize our hands? Are we able to put on masks? I think this is something that we should be able to do, just you and that, so that we don't escalate the spread of the pandemic. It's sad to see that most people are not doing this. Others deliberately, while others, I think, because they cannot afford. We have been able to go around these various communities, how we have interacted with the vulnerable who cannot manage to buy a bar of soap, who can manage to buy a mask, even a hand sanitizer, and their plea has been government should be able to come to their aid and distribute these commodities for free. In other compounds where distribution has been done, like Mateo, I just had an interview with the traders in one of the local markets there, and their complaint really is that the way these PPEs are being distributed leave much to be desired, because what they have been able to see is the ease of vehicle moving and just throwing, the PPEs, which can also be a danger to the communities that would rush to pick up the PPEs. So I think more really needs to be done on this particular issue, even as we talk about fighting COVID-19.
And one of the responses that I was given in one line, and some of those people that were exercising as early as 0 or 4 hours. I spoke to one young lady, and her response was, I'm a footballer. I want to turn into a professional footballer, and this is the only place that I can train from, because all these other facilities are closed. I also spoke to one of the young men that had assembled on the bridge to exercise. His response was, in Zambia, we are being told that we have severe cases of COVID-19. In other countries of theirs, we see people, or rather media houses, televising these patients and everything. For him, he does not believe that Zambia indeed has COVID-19, because he is yet to see a sick patient, or even somebody who has lost his life because of COVID-19. So it's a sad situation, but this is the real truth on the ground. Some people cannot believe that COVID-19 is real, because they are yet to see somebody preventive measures. When you look at the death toll, which stands at over 300,000, you should be worried. And what if it could be you next, but are you going to avoid that by ensuring that you adhere to all the measures? We'll be crossing to Minister of Health, Dr. Stolten, once he settles, but for now, continue watching television. Good morning.
so today everyone is aware of what will be taking place in as far as the update is concerned. And all eyes obviously are on the 3-month-old baby and also just other measures that are being put in place. I know that there have been a lot of developing stories around the COVID-19, and we will get an update from the Minister of Health. He is here and he will be addressing the nation just now. So let me hand you over to the Minister of Health, Dr. Chitara Chilufya.
Good afternoon, countrymen and women, and good afternoon, members of the press. I recognize our permanent secretaries and Professor Lloyd Mlenga leading the cluster on case management. I recognize Professor Babu, public health guru among us. Ladies and gentlemen, countrymen and women, Zambia has set a very important. We conducted 785 tests. Out of these 785 tests, 1 case of COVID-19 was recorded. We have also been investigating a death of a gentleman who came to the hospital who has been long known to us as a chronically ill patient with cancer of the colon and a chronic respiratory disorder. This is a patient who is known to have had tuberculosis and pneumonia, and later on was found to have had cancer of the colon with spread to all parts of the body, what we call metastasis. This patient came in ill and was pronounced dead on arrival at the hospital and was swabbed, and COVID-19 was detected. So this is a patient who was chronically ill with a chronic respiratory disorder with a history of TB and pneumonia and CA of the colon or cancer of the colon with spread to all parts of the body, who came in his terminal illness, who came in his end stage and was pronounced dead, but out of the protocol was swabbed. Therefore, by protocol, we have notified another case of COVID-19, and by protocol, we will classify it as a COVID-related death. The new case has been placed in our isolation facility and all their contacts are being traced. In the last 24 hours too, we have discharged 14 patients, and this includes one who was in Masaiti Isolation Center and a health worker, and of note, the 3-month-old baby who we reported previously as being very ill has also recovered successfully and has been discharged. Therefore, the number of active cases is now 43, with 37 in Lusaka and 5 on the Copper Belt and 1 in Kabwe. All the patients that we have now are stable, and we therefore have recorded in total 92 recoveries. So while we have 43 active cases, we have recorded 92 discharges, people who have recovered and have been discharged home. Amongst the high-risk persons who we've been monitoring, we have successfully discharged 3,370 persons, and we have also responded to 1,456 alerts that have been cleared as non-cases. Members of the press, countrymen and women, community and health-based care screening for COVID-19 in Muchinga province commenced yesterday, and we managed to screen and test 456 cases. The operation continues today, and it is involving truck drivers, members of the community, healthcare workers, immigration department workers, staff in the lodges, and many other stakeholders who are found in Nakonde. Globally, we have recorded 3.6,446,261 cases with 252,420 deaths. This is also being reported together with recoveries at 1,200,282. Back in Africa, we have 48,081 cases and 2,651 reported just in the last 24 hours. And that is the surge in Africa. We have recorded 1,848 cases and recoveries stand at 16,231. Distinguished ladies and gentlemen, today is a special day that is recognized as a day for hand hygiene, which is celebrated annually. So let us align to the theme of this day, which is Save Lives. Clean your hands. Continue to wash your hands frequently with soap and water, or sanitize with alcohol-based hand rubs. In addition, let us continue to adhere to the measures stipulated to control and prevent further transmission of COVID-19. Remember, public gatherings are restricted. Practicing personal hygiene on a day this special should be prioritized. Always put on masks when you're in public and notify suspected cases. The case that we have recorded in the last 24 hours was an alert from Matero. And this is the way it should be. An alert member of the community picked up the call, called the toll-free number, and alerted us of a case in the community. We sent our rapid response teams and picked the case, swabbed the patient, put in isolation, and the case came out positive, and the patient is under our care and recuperating. Let us continue practicing physical distancing, and this way we're going to win the fight. Again, I emphasize that there is need for us to work together to ensure that we screen everyone in the epicenter or in selected parts of the country and ensure that all those who are due for testing are tested. Determining the degree of the disease is critical. Therefore, mass screening and targeted testing will continue in different parts of the country, particularly Lusaka, Nakonde, Kawe, and Kafue. This way, we'll be able to come up with a real extent of the problem. Further, we have commissioned research of a prevalence study in Lusaka that is due to commence next week. We continue to mourn our young biomedical worker who passed on in a tragic accident and will be buried tomorrow in Impika, and government is supporting the process fully. We thank you most sincerely for coming today, and we will meet again. Today being Tuesday, we'll meet again on Thursday, as tomorrow we will be burying our health worker and we'll give a press statement on the figures. We thank you for coming.
Thank you so much for that update, Minister. We'll take questions from the members of the press. Thank you at a time. Please pass and speak through this microphone and use it for your press service on anything that you want to make clarification on. Do you have any questions? Yeah? Yeah? Please come through.
My name is Deborah from NCTV. So the first question I'd like to find out if the Ministry of Health has received a letter from Mendes Clinic International, who have said that found a possible cure for COVID-19, and if you are considering looking at it, if you have received a letter. And the second question is from UPND MPs who are saying that don't receive any masks from the Ministry of Health. So the saying would like to know what criteria is being used to give it now. My name is Patience from the CCTV. I just have one question. What is the government or under the Ministry of Health, what measures are they going to put in place in order to have a reduction in the escalating numbers of the cases? Thank you.
I have about two questions. Among the people that we now have in our facilities as active cases, I want to know how many are asymptomatic and those that are asymptomatic, because I believe that if we are not showing symptoms, it's very easy for other people to also catch the virus because they don't really know what people carry. Then the other question is on the 4 health workers from Chile. Maybe give us background to where they were, because earlier on we did indicate information that almost all the health workers at that facility had been tested. Where were they? They should have given information on their whereabouts. Then the breakdown on the distribution of personal protective equipment in the epicenter of Saka, because there is information coming out now that some health workers are linked to pay just for them to have those personal protective equipment. Then the death, the 4th death, which is as a result of COVID-19, we are not given information on where he is coming from. I might have missed that. Thank you.
Do you have any other questions? Okay, so I can come.
Good afternoon, Honorable Minister. Great from KBNTV. My first question, the Biomedical Union of Zambia yesterday issued a 48-hour ultimatum to the Ministry of Health, directing them to provide health workers across the country with PPEs. What's your response? The second question is, last week, the ministry, you announced that about 2,100 health workers have been, with reference to the 3,000 plus health workers that the president directed that are supposed to be employed. We want to find out if at all you communicated with them via letters or phone calls, and if they have received those phone calls or letters, and where are they deployed, and how are they going to start working? Thank you.
Thank you. Do you have any other questions? Seeing none in this series, I'll call upon the Honorable Minister to give responses to some of these questions that are presented.
Thank you very much. The question on whether we have received a letter from an organization, you called it what, from Movie TV?
Mendes Clinic International.
Mendes. Right. Whether we received a letter indicating that they have a cure?
Yes, they said they sent a letter here, so they said they have a letter which indicated that they sent it on 30th April to the Ministry of Health.
Right. In the first place, we have not received that letter that indicates that there is a cure. Secondly, we have not recorded any molecule in Zambia that is known to cure COVID-19. However, it is important to state that we will not stifle research, And all scientists are free to be on board to come up with research questions with molecules that they believe carry the efficacy, but will be subjected to the protocols that exist that require testing for safety, testing for efficacy, to clinical trials, and so on and so forth. So that protocol will be demanded for us to secure the health of the public. So we will not be stampeded into accepting anything pronounced as a cure, but we will be very receptive to anybody who comes up with a proposal, as long as they are happy to subject it through the standard protocols, so that we can ensure that as we give credence to such a product, we are on terra firma and we are backed by science. So this is the reason why we are engaging all those who we've heard about. For instance, we've heard about a product in Madagascar, and our research team is in contact to find out more about that. And also, we're working with the Africa Center for Disease Control to ensure that we can find out more about, that. So we are open, but for now, it should be made very clear there is no cure to COVID-19 that we have here in Zambia. The UPND masks, I want to tell you again that COVID-19 is a national problem, and it summons all of us across the political aisle to fight from a common front. And all members of parliament are working together to ensure that the public is protected from COVID-19. We are working with members of parliament from all political parties. As we speak, there are some members of parliament who right now are collecting masks. Yesterday, we were collecting masks from the opposition. And so there is unity of purpose, there's solidarity, and we are working together without discrimination. So that report is unfounded. How do we de-escalate the number of cases? We have to ensure that, one, we strengthen our ports of entry and avoid importing new cases. Two, we have to heighten surveillance in our health facilities, in the community, to ensure that we actively find cases. And those cases, we should ensure do not transmit to the next persons in their contact. So those cases need to be isolated and treated. Therefore, we are stopping community spread. So the strategy is surveillance, screen, test, isolate, treat. Use of PPEs, disinfect public places, and ensure that we avoid public gatherings and observe physical distancing. That's the remedy to avoiding new cases. What we're doing as government resonates with what has been pronounced in our strategic plan and what has been pronounced in the presidential address. Our strategy anchors on active case finding through surveillance at facility and port of health entry and community level, and we are managing these cases from our various isolation facilities, quarantining those, and also contact tracing actively to ensure we weed out everybody who would have been in contact with the positive cases, and also ensuring that disinfection of public places takes place so that we remove any particles that could be the anchor for COVID-19 microdroplet containing droplets. Therefore, we are moving in that direction. What's the breakdown of PPEs in Lusaka? And are there people paying to get PPEs. Is that your question? What's the breakdown of PPEs? Could you explain what you mean by breakdown of PPEs? The health workers have to do what? Right. There is no health worker who is paying to get a PPE from the Ministry of Health. All health workers who are receiving PPEs are receiving the PPEs without paying for it. So we have mobilized PPEs using the contingency fund. We have mobilized PPEs from well-wishers, cooperating partners, a business world, and this PPEs priority number one is the health worker. We do not want the health worker to contract COVID-19 in the line of duty. So we are not demanding payments from anywhere, and so that is unfounded. Where are these PPEs in Lusaka? It depends on the human capital density. Where you have 100 workers, you'll have this amount of PPEs. Where you have 200, you'll have double the amount of PPEs. So the population, catchment population for various facilities in Lusaka differs. And so the amount of PPEs distributed to each facility is commensurate to the number of health workers in those facilities. And for the population, equally, it is also dependent on the population that is in those areas. Biomedical Union of Zambia directing us to distribute PPEs. Well, I'm sure you meant to say advising or calling for. Did you mean directing? Because being a journalist, I'm sure you meant directing? Well, we recognize the professional bodies as our partners in the provision of health services. And we've continued to work together with them in order to improve delivery of health services. We sit in various platforms, various fora, to discuss how best to provide health services to our people and how to improve the welfare of our colleagues at the front line. Therefore, the engagement that we have is not one where they direct or we direct, but it's one which is premised on mutual understanding and also on promoting the common interest of the citizen, that is to ensure universal health coverage. So we have not received such a directive. However, the Biomedical Union of Zambia have been our key partners, and we discuss various things amongst ourselves to improve health service delivery. Human resource that we have recruited, like I alluded to in my last address, we had recruited 2,100 plus health workers, and that we were concluding on the others this week. These health workers that have been recruited are being deployed to various parts of the country and to various ports of entry and various COVID centers. So this process is ongoing and so far has been conducted in a very, very transparent manner.
Thank you so much, Honorable Minister. That was the last series of questions and all comments. Do you have any other questions? Okay, I will go ahead to Mayor, you want to come back? Okay. So, you don't have an answer? You can have the three of you.
Well, mine is just a
Are the police here? We need to investigate how you managed to get a letter from our officers. Maybe it's a forged stamp. Maybe you've got accomplices. You help us with investigations.
Okay. My other question is concerning health workers from Zambezi East. So the comment from the MP there, he's saying the health workers are working without protective gear. So I'd like to find out from the Ministry of Health. The second question is, on that note of commissioning officers have received the masks, which you say we're donating.
What was your first question?
From Zambezi East, where the health workers are said to be working without protective gear. So that comment was from the MP.
Well, I just want to assure you that as I was walking down here, I met our senior parliamentarian and head of the opposition in Parliament, and he said, and I'm referring to Honorable Jack Mwimbo, that they are walking away smiling. So we're working very well with the opposition members of Parliament, and like I said, when it comes to health, we're bipartisan and we unite to fight this pandemic. All citizens countrywide need to be protected. So there's no discrimination, and investigate, talk to the head of the opposition, and you realize that indeed we're working together, sharing what is available. Sharing what is available. So we are not going to discriminate, and we do not discriminate. So citizens in Zambezi, citizens in Lunga, citizens every part of the country are part of President Lungu's universal health coverage agenda, and therefore we will leave no one behind. The little we have, we will share. We also urge people in various parts of the country to join the bandwagon in their corporate social responsibility programs and ensure that they sew some of these face masks and distribute to the communities in their jurisdictions. That is a very important call to action.
Thank you so much. Any other questions? We have one last series.
Yes, Honorable. Mine is on the clarification between the death and the new positive case. Which one, I don't know which one is coming from Mateo, where is the death or the new case. Then there's also on the collection of several samples of the suspect brother in Zambezi. Maybe we want to know why there was need to conduct to get a second sample when there was already one that had been recovered on the power tools bus, which was involved in an accident.
Do you have any other questions?
Honorable Minister, I feel you haven't answered my second question. Instead, you gave a general answer. Do we have specific places where these people are deployed, and the form of communication that the ministry used to communicate with them said you received a call or a letter, you will be going, you're receiving a training? Thank you.
Well, that is administrative, but you're free to actually check with administration for specific places. But I can tell you from a strategic perspective that this human capital we are employing, being deployed at various ports of entry, such as Nakonde, Chirundu, Kazungula, and all the facilities where we're treating cases, such as Levi Mwanawasa, Courtyard Hospital, and all these other facilities where we are emphasizing resilience in health services for continuity of health service provision. So as to where each one of the 2,100 workers are, that's an administrative bit, but feel at liberty to contact us through our administration offices to see exactly where they are. And where the death came from, Chamba Valley. Chamba Valley. Yeah. And did you ask about the samples from the accident scene? Sorry? Yes, the sample result was negative.
The question was why there was need to get another sample that already been run on the part which you did available that it was retrieved.
The question is?
Why you had to get a second sample later? Well, you had one already which had been retrieved from the accident first.
I see. That's for control purposes. It's a control sample.
Thank you so much, Honorable Minister. You handled all the questions. There's one.
Can you give us more details, Honorable Minister? We did not respond on the Chilenge.
Could we be systematic in terms of the Chilenge issue? I think which you raised, but we raised it and that's the name of the minister to actually make a response to that.
About Chilenge?
The 4 health workers that were announced.
Yes.
Yes, and that's the last that
Oh, the 4 health workers that were announced, yes, weren't at the facility at the time, but they were in isolation in their homes. Yes.
thank you so much, Honorable.
Are you writing about the term control purposes? It's you know.
Most other people were being sprayed from the clinic.
Mhm.
Why were they in isolation instead of going to the clinic, spraying together with other people?
Well, they were in isolation, and that was good enough as they were off duty. And all we did is follow them in their isolation and tested them. Then their results came out, later. But the good thing is that they were in isolation, and so they were not spreading, the illness. Yeah.
Thank you, Honorable Minister, for that. Do you have any questions or anything that you want to clarify for Honorable Minister? Okay, seeing none, Honorable Minister, today we also have some more people coming to support the fight against COVID. We've got 2, Cleaning Association of Zambia, represented by Lawrence Makumbi, and then we've got the WZBF. So may I have 3
I think the offer from Mr. Lawrence Makumbi cannot go without a comment. This is an unprecedented solidarity and should be benchmarked by all of us. The spirit really is that we should all see what we can contribute for us to fight COVID-19. So that is a lot of sacrifice, and we appreciate the solidarity. It's unprecedented. And I also want to counsel Shimumbi, who goes into quarantine, some form of quarantine, illegal. That's the kind of quarantine we need, where Lawrence Makumbi is going. It's a public quarantine, and we know where he is, and he'll be working, with us at appropriate, places. So thank you very much, Lawrence, for that counsel to the public.
Thank you so much. We still have one more, and I'll call upon Isabel. Isabel from the UF. So I'm going to give a short statement.
Thank you very much. Honorable Minister, COVID globally, even when you give us these daily updates, we are alive to the fact that the threat of COVID-19 in Zambia still remains imminent. We are in support of the measures that the Ministry of Health has so far issued to safeguard public health. And we again stand in solidarity with other stakeholders in supporting the Ministry of Health to ensure that this fight is won and that everyone in Zambia is protected. We continue to acknowledge and recognize your leadership, and with this, we just want to say that the entire country is counting on you to take us to a better place, because we are a people of hope and we are a country of hope. So the recoveries that we continue to talk about each day, those are the things that keep us hopeful that something is actually working, that is being done by the ministry, and we are on the back of that. As we have said, your task is not an easy one, and as such, at WWF, we continue to look at ways in which we can provide support to your ministry and to your government. I am sure that many people are wondering what is the relationship between conservation and health. Just wanted to say that WWF does not just work to restore nature, but our business is also about ensuring that people and nature coexist, and that basically people are able to thrive. We do know that health pandemics are a threat to both people and nature, and for this reason, we find strong relevance in asserting our actions to support the fight against COVID-19. To support this fight, we are releasing a donation today to the Ministry of Health to support frontline staff, particularly in hotspot areas, where you have amplified and increased the level of disease surveillance and screening. We are releasing a donation worth 88,740 kwacha, which constitutes 1,200 face masks for our frontline health staff, latex hand gloves, 50 boxes, Dettol bar soap, 175 grams, which are 1,200, disinfectants such as Dettol liquids, 750 mils, these are 100, to support cleaning in the COVID centers where you are looking after our patients. And hand sanitizers, 400 grams, these are 20, these are actually boxes. And we are also donating 240 liters of bins with wheels to ensure that the management of medical waste is also taken into consideration. We've also provided hygiene mops with aluminum handles, and these are 30. Allow me, Honorable Minister, as I end this brief message from that live in or around game management areas. And these communities can be very hard to reach. And much of the information that many of us have the privilege to know around COVID-19 may not be as easily accessible to them. It is our appeal also that as we conduct health promotion in the districts, we also consider stronger partnerships with other partners, like-minded institutions like WWF, to ensure that this life-saving preventive information can be sent out to these communities that are in such communities. Thank you very much for this opportunity. And the items we are donating are displayed outside, and we'll be happy to just showcase what it is in our work. Thank you very much.
Thank you. That was the last in our presentation. So that's the research.
Well, thank you very much again to WWF for partnering with government in the fight against COVID-19. Indeed, there is need for nature to be looked after, and there is need for that coexistence between human beings and nature. So we appreciate the support that you're giving in Sioma and Sesheke in the hard-to-reach areas, and thank you for the broader support to the COVID-19. We also thank you for the words of encouragement and solidarity, and that urges us on as health workers. As we conclude today, a few key points. The cold season is just in the corner, and let us ensure that we keep warm and keep away from things that cause allergies. So we caution the public, alert the public that with the cold season and what we know does or that predisposes us to flus, let us ensure that we keep away from those and we keep warm, as we know that the cold weather, which does bring with itself a flu season, may actually worsen the pandemic. We also want to emphasize the need for all of us to heed to what has been pronounced through the presidential address and through various regulations to stay home and be safe and to wash hands and observe physical distancing and mask up and avoid public gatherings. We'd also like to report to the nation that this week we'll begin to receive 600 returning Zambians from India and South Africa, and we will be starting with the first 60, and as they come back, they will be quarantined for 14 days at honors cost. Today is the International Midwifery Day, and would like to recognize the efforts of our midwives in playing midwife to our birth, and also in protecting all the children during the early childhood, and also looking after our mothers in pregnancy. We appreciate what you do as midwives in our lives, and we're very proud of you, and we wish you happy Midwives Day. We want to thank all of you who have been donating generously to the cause, and urge you on, and let us all hold hands and coordinate with His Excellency President Lungu's team to fight COVID-19. So for today, 14 discharges, including our 3-month-old baby, and 1 case from Masaiti in Indola. We have 42 active cases, and we have in total 92 recoveries. This is where we are today, and we'll see you tomorrow. We'll see you on Thursday.